is benign. Our lecture today is benign vulval disease. Benign vulval disease. Vulva is the term will be used to describe the external female genitalia. When we are saying vulva, this is mean external organs. Include labia majora, labia minora, clitoris, and fourchette. Vulva is external organ, include labia majora and minora, clitoris, and fourchette. What is meaning of the vestibule? Anatomically, it is an area between the lower end of the vaginal canal at the hymenal ring and the labia minora. This slide shows description for the vulva, which is mean external female organ, include labia majora, labia minora, and clitoris and the fourchette. Vestibule is an area between the lower end of the vaginal canal at hymenal ring and the labia minora. What are the vulval skin has different physiological properties. What are these properties? Which is differs from other properties of the skin of other area, like in forearm. There is a transepidermal water loss is twice the amount in vulval skin when compared to forearm skin. These important physiological properties include transepidermal water loss is twice the amount in vulval skin when compared to forearm skin. So that will be poorly used as a skin barrier and will be explained that vulval skin is more prone to irritancy. Vulva is external organ, include labia majora, minora, clitoris, fourchette. Vestibule is an area between lower end of the vaginal canal at hymenal ring and the labia minora. Physiological properties related to vulval skin is transepidermal water loss is twice the amount in vulval skin compared to forearm skin, so that is more liable for irritancy. What is meaning of the vulvitis? This is mean inflammatory reaction will be affect vulval structure. Classification: primary and secondary. Primary and secondary. Primary will be specific for the vulva, while secondary there is urinary, vaginal condition, rectal, and iatrogenic may be allergic. Then has the secondary causes of vulvitis here either urinary, vaginal, rectal, or iatrogenic. While the primary inflammation is specific for the vulva, like sexually transmitted disease, skin disease, and chronic specific infections. Sexually transmitted disease includes syphilis, soft sore, gonococcal, lymphogranuloma, herpes simplex, human papillomavirus, and molluscum contagiosum. While the skin disease like moniliia, furunculosis, tinea cruris, psoriasis, pediculosis, and scabies. And the second point is for the skin disease is intertrigo. This is non-specific inflammation in skin folds in obese cases. Chronic specific infection, TB, bilharzia, and filariasis. We are repeat, vulvitis is mean inflammatory reaction affecting vulval structure. Classification either primary or secondary. Primary, which is mean specific for the vulva, include sexually transmitted disease like syphilis, soft sore, and go on. Skin disease like moniliasis, tinea cruris, psoriasis, and other, and non-specific inflammation in skin fold in obese cases. And the third point is chronic specific infection like bilharzia, tuberculosis, and filariasis. When we are saying classification is primary and the second point is secondary. Secondary to other organs like urinary, vaginal, rectal, or allergy. What are the features of the acute vulvitis? Clinical picture. What are the symptoms and signs? Symptoms like the following: pain and pruritus, redness and swelling of the vulval skin, frequency of micturition, dysuria, and maybe lymph-inguinal adenitis. Symptoms: local pain and pruritus, swelling and redness of the vulval skin, dysuria, frequency of micturition, and inguinal pain due to inguinal adenitis. What are the signs related to vulvitis? Edema and congestion of vulval area, warm and tender, presence of swelling like Bartholinitis abscess. Maybe there is firm tender inguinal mass due to inguinal adenitis, and rarely constitutional manifestation when severe spreading infections and if abscess develops. As we say, the vulva is external organ, include labia majora, minora, clitoris forchate, vestibulum, meaning an area between the lower end of the vaginal canal at the hymenal ring and the labia minora. Properties related to vulval skin is transepidermal water loss is twice the amount in vulval skin when compared to skin of the other area like forearm, so more liable to irritation. Vulvitis is inflammatory reaction affecting vulval structure, maybe primary and maybe secondary. Primary, this is mean specific for vulva, either sexually transmitted disease, skin disease, chronic specific infection. Sexually transmitted disease, example, syphilis, soft sore, and other. Skin disease, example, fronculosis, moniliasis, tinea chlorus, and non-specific inflammation in skin folds in obese cases. Chronic specific infection like bilharzia, filariasis, and tuberculosis. While the secondary causes for vulvitis, either urinary, vaginal, rectal, or iatrogenic allergy. What are the clinical or symptoms of the acute vulvitis? Pain, local pain, pruritus, redness and swelling, frequency of micturition and dysuria, and inguinal pain. Signs: edema and congestion. Vulva is warm and tender. Local inflammatory swelling, such as Bartholinitis abscess. Tender, firm inguinal mass due to inguinal adenitis. And rarely constitutional manifestation may be evident in cases with severe spreading infections and if abscess develop. What are the most important investigations? Swab for culture and sensitivity, serological test to exclude sexually transmitted disease, investigation for urinary tract infection, for diabetic, and investigation for associated vaginitis. Investigation include swab for culture and sensitivity, serological test for sexually transmitted disease, investigation for UTI, diabetic, investigation for associated vaginitis. Treatment of acute vulvitis include the following: general measures. Second, suitable antibiotic. Third, treatment of predisposing factors. Fourth, treatment of complication. General measures will be include local cleaning by shaving of the hair, local dryness of the area, local antiseptic like betadine, sexual abstinence, physiological rest, antihistamine, sedative or hypnotic, and estrogen therapy to increase vulval epithelial resistance in children and postmenopausal women. We repeat: general measures for acute vulvitis: local cleaning of the area by shaving of the hair, local dryness by wearing cotton pants, local antiseptic, sexual abstinence, antihistaminic and sedative, and the last one is estrogen therapy. The second point is suitable antibiotic according to the causative organism, treatment of predisposing factors such as diabetic and malnutrition, decrease immunity, and a treatment of complications such as draining of Bartholinitis abscess. تحدثنا بهذه المحاضرة حول الفالفا. We take the vulva, it is external organ, include labia majora, minora, clitoris forchate. Vestibule is an area between the lower end of the vaginal canal at hymenal ring and labia minora. Physiological property related to vulval skin, which include transepidermal water loss, is twice the amount in vulval skin when compared to forearm skin, so more liable for the irritation. What is meaning of the vulvitis? It is an inflammatory reaction specific to the vulva. Classification: primary and secondary. Primary, which include sexually transmitted disease, chronic specific infection, and skin disease. Secondary will be related to urinary, vaginal, rectal, and iatrogenic. Then we talk about the symptom and sign and investigation, and the last one is the treatment of the acute vulvitis. Answer with the true or false for the following statement. The vulva is an area. Vulva is an external organ, will be include labia majora and minora only. True or false?
False.
False. Include labia majora, minora, clitoris, and forchate. Vestibule is an area between the lower end of the vaginal canal at hymenal ring and labia majora.
False.
Labia minora. Acute vulvitis is an inflammatory reaction specific to the vagina.
False.
False. Acute vulvitis is specific to the vulva. Specific to the vulva. لكن إذا كانت specific to vagina راح نقول هنا vaginitis. Urinary condition and vaginal and rectal condition may be considered as primary causes for acute vulvitis.
False.
False.
Secondary.
Secondary, yes, very good. Tuberculosis and syphilis are primary causes for acute vulvitis.
True.
True. هذه هنا tuberculosis بالchronic specific infection, وهذه syphilis بالsexually transmitted disease will be considered as a primary condition. Yes. Edema and congestion of the vulval area with evidence of itching marks is considered as a sign for acute vulvitis.
True.
True. Sign, edema, congestion with itching marks. This is a sign for acute vulvitis. Serological test for sexually transmitted disease and investigation for urinary tract infection are important investigation to diagnose acute vulvitis.
True. True.
لأنه إحنا نرجع قلنا هنا واحد من causes sexually transmitted disease، إذا المهم إنه أسوي investigation إذا. وبالسكندري كوزز قلنا ممكن تكون urinary symptom، فإذا هنا نحتاج to diagnose acute vulvitis this investigation. Yes. Local pain and pruritus are important symptoms of acute vulvitis.
True.
True.
هذه قدامكم. Local pain and pruritus هي أول نقطة بالsymptoms. أول شيء تيجي علينا المريضة بالأكيوت فالفايتس عندها local pain and pruritus. Yes. As we say, treatment includes the following: general treatment, suitable antibiotic according to causative or microorganism, treatment of predisposing factors like diabetic and malnutrition, and the last one, a treatment may need a drainage of the Bartholin abscess. What are the general measures important for treatment of acute vulvitis? Local cleaning, local dryness, local antiseptic, sexual abstinence, antihistaminic, and estrogen therapy. Local cleaning of the area by shaving of the head, local dryness, local antiseptic, and sexual abstinence, then antihistaminic and estrogen therapy. We talk about the diabetic vulvitis. لما نجون ويا الدايابيتك احنا قلنا نسوي انفستيجيشن للدايابيتك تو اكسكلود الاكيوت vulvitis حتى نبدا بالتريتمنت. It is the product of recurrent vulval candidiasis. لما تيجي المريضة عندها recurrent candidiasis أول ما نفكر حتى لو هي ما عندها history of diabetic مفروض نديسها random blood sugar oral glucose tolerance test نتأكد من عندها diabetic ولا لا. وأيضا بالفاميلي history راح نسألها إنه عندهم family history of diabetic، وإذا كانت هي para 2 para 3 يعني deliver أيضا نسألها عندها gestational diabetic ولا لا من ضمن الهيستوري. فلأنه يصير عندنا diabetic vulvitis. It is a product of recurrent vulval candidiasis and secondary bacterial infection, may be chronic with epithelial changes due to chronic irritation and pruritus. Symptoms of diabetic vulvitis may last for a long time after diabetic control and after treatment of all microbial infection. Then the features of the diabetic vulvitis راح تكون recurrent vulval candidiasis, recurrent, maybe with secondary bacterial infection. The symptom may last for a long time after diabetic control. يعني المريضة هي diabetic وإجتنا uncontrolled. حتى لو controlling للراندوم blood sugar ممكن تبقى عندها هذه الcandidiasis for a long time and after treatment of all microbial infection. What are the characteristics of the diabetic vulvitis? Extensive separating infection قلنا هنا recurrent vulval candidiasis and secondary bacterial infection. هنا راح يكون extensive separating infection. Reddish gray area, severe itching due to glucosuria, diabetic neuritis, inflammatory process associated monilial infection. Treatment, control of diabetic, treatment of vulvitis, and a treatment of monilia or other genital infections. Diabetic vulvitis. It is the product of recurrent vulval candidiasis and bacterial infection. Symptoms may be last for a long time after diabetic control and after treatment of all microbial infection. What are the characteristic features of diabetic vulvitis? Extensive separating infection, reddish gray area, severe itching due to glucosuria, diabetic neuritis, inflammatory process, and monilial infection. Control the diabetic, treatment of vulvitis, treatment of associated monilia. Answer with the true or false for the following statement. Severe itching in a woman with diabetic vulvitis may be due to glucosuria or diabetic neuritis.
True.
True. Causes of severe itching here may be glucosuria, diabetic neuritis, or inflammatory process. Symptoms of diabetic vulvitis may be last for a short time after a diabetic control.
False.
False. حتى لو يصير diabetic control may be lasting for the long time and after a treatment of all microbial infection. A brownish area and extensive spreading infection are a characteristic of diabetic vulvitis.
False.
False.
False. قلنا reddish. Yes, yes. Okay. We talk about the Bartholinitis. Bartholin gland. When inflammatory process include to the Bartholin gland, this is Bartholinitis. Usually caused by gonococcal infection. إذن البارثولين gland السبب أكثر شيء usually عادة gonococcal. Occasionally by biogenic organism or chlamydia. And this is due to obstruction of Bartholin glands. Bartholinitis, this is Bartholin gland, inflammatory process. The cause is gonococcal and may be due to chlamydia, lead to obstruction of Bartholin gland. What are the roots of infection? Either sexual or post-operative or postnatal or spreading from the vagina. The most common cause for the Bartholinitis microorganism is gonococcal, occasionally by biogenic organism or chlamydia due to obstruction of this gland. Route of infection, sexual, exogenous, spreading from the vagina. Clinical picture, نفس الفالفايتس. أيضا راح يصير هنا local pain, pruritus, inguinal adenitis, inguinal pain, redness of the area, swelling. Tender, firm mass in the posterior third of the labia majora, which become fluctuant when suppression occurs. And the overlying skin is red, edematous, and indurated inguinal adenitis. Then, like the vulvitis, راح يصير local pain, pruritus, tender, firm mass, posterior 1/3 of labia majora, redness, the skin red, edematous, indurated, and inguinal adenitis. Investigation, like vulvitis, أيضا exclude diabetic urinary tract sexually transmitted disease. The treatment, also like vulvitis, general and specific microorganism will be given antibiotic, antiseptic. Drainage, if there is Bartholin abscess, and this is excision of the Bartholin gland in cases of chronic abscess. Treatment of vulvitis, drainage of abscess, and excision this gland if there is a chronic abscess. We are repeat, Bartholinitis is inflammatory process of Bartholin gland caused by gonococcal, usually and rarely or occasionally by chlamydia or biogenic organism. Root, sexual, postnatal, post-operative, spreading from the vagina. Clinical picture like vulvitis, tender, firm mass in the posterior 1/3 of labia majora, and maybe red, edematous, inguinal adenitis. Investigation like vulvitis, treatment like vulvitis if there is abscess, drainage, and excision of Bartholin gland in cases of a chronic abscess. إذن المحاضرة اللي تحدثنا عنها كانت في البداية هو definition of the vulva, which is include the labia majora, minora, clitoris, forehead. الفستيبيولا عرفنا شنو this area between the lower end of vaginal canal and labia minora. The most important physiological property to the vulval skin is the transepidermal water loss is twice the amount in vulval skin when compared to forearm skin, so that more liable for irritation. We are talking about the vulvitis, definition and inflammatory reaction, classification either primary or secondary, primary sexually transmitted disease, skin disease, chronic specific infection. Now, most common syphilis, soft war, furunculosis, monelia, GB bilharzia. What are the secondary causes for vulvitis? Enumerate the secondary causes for vulvitis. احنا تحدثنا عن البرايمري هسه حاليا الفولفا. secondary causes منو هي للفولفايتس؟ ايش راح يتضمن لما يقول secondary اذا not specific for vulva؟ what these are؟ urinary
urine condition, vaginal condition,
rectal, vaginal,
yes very good, and iatrogenic allergy.
iatrogenic.
yes. symptoms vulvitis من اسمه هو inflammation، فإذا يصير pain, redness, pruritus, edema, frequency of micturition and inguinal adenitis. الساين edema and congestion الفيرم هنا warm and tender الفولفا local swelling mass. investigation قلنا swab culture sensitivity, investigation sexual transmitted disease urinary tract diabetic and investigation for associated vaginitis. General measure local cleaning, local dryness, antiseptic, sexual abstinence, antihistaminic and estrogen therapy. Suitable antibiotic, treatment of a predisposing factor, and the last one a treatment of complication like drainage of Bartholin abscess. Diabetic vulvitis, this vulvitis, it is recurrent vulval candidiasis with secondary bacterial infection. The symptoms may be last for a long time after diabetic control and after treatment of all microbial infection. Here there is a glucoseuria, diabetes neuritis, inflammatory process may be cause a severe itching, and there is reddish gray area, extensive spreading infection. Treatment, control diabetic, treatment of vulvitis and treatment of mononuria. Bartholinitis, definition is inflammatory process of Bartholin gland. The most common cause gonococcal, occasional chlamydia or biogenic organism. Route of infection sexual, postnatal or post-operative, يعني exogenous and spreading from the vagina. Investigation, treatment and clinical picture like vulvitis, but there is tender firm mass in posterior third of labia majora, and the overlying skin is red, edematous, inguinal adenitis. And the treatment, if there is a chronic abscess, may be needed to excision of the Bartholin gland. And if this abscess for the first or second time, may be a drainage. Okay. We're talking about the pruritus vulvae. Pruritus vulvae. Vulval itching. Pruritus vulvae, what are the causes? This pruritus either associated with vaginal discharge or without vaginal discharge. Pruritus vulvae, pruritus itching. أما يكون وياها vaginal discharge أو 20% من النساء without vaginal discharge. Causes general, local causes. General أيضا systemic disease like diabetes, jaundice, uremia and leukemia, allergy, vitamin A deficiency and chlorhydra, psychology like neurodermatitis. Vulval itching, pruritus may be associated with vulval discharge, vaginal discharge or not. Without vaginal discharge, about 20% of cases. General causes, systemic disease such as diabetic, jaundice, uremia and leukemia. Allergy, vitamin A deficiency, chlorhydra or psychological neurodermatitis. What are the local causes of pruritus vulvae, vulval itching? Either non-neoplastic epithelial disorder will be named dystrophies, vulval dystrophies, or these cases due to skin disease, whether fungal, parasitic, or allergic. And the last one, secondary to anal pruritus due to oxyuris infestation. Due to oxyuris infestation. We are repeat. Pruritus vulvae, vulval itching, may be pruritus associated with vaginal discharge, or maybe without vaginal discharge, only itching. And this is account for 20%. What are the general causes of pruritus vulvae? Systemic disease such as diabetic, jaundice, uremia, and leukemia, allergy, vitamin A deficiency, and neurodermatitis. local causes such as dystrophies and maybe fungal or parasitic infection or oxyuris infestation, secondary to anal pruritus due to oxyuris infestation. Vulval candidiasis. This is caused by من اسمها candidiasis Candidia albicans. Candidia albicans. Diagnosis by biopsy. Treatment 7 to 10 days of topical fluconazole therapy. Resistance cases of fluconazole orally 150 milligram weekly for 6 months. Vulval candidiasis. The cause Candidia albicans. Diagnosis confirmed by biopsy. Treatment 7 to 10 days of topical fluconazole. 7 to 10 days. In resistance cases, will be give the patient a fluconazole. This capsule is 150 milligram dose of this capsule orally weekly for 6 months. نقول لهم كل أسبوع تاخذين كبسولة لمدة 6 أشهر. This is in resistance cases. What are the important investigation for vulval candidiasis? Urine analysis for sugar glucose tolerance test لأنه أكثر شيء تجي ويا الدايابيتك. Examination للscrubbing due to fungus infection. Full blood count and serum bilirubin, stool analysis, and the last one biopsy may be taken from any suspicious lesion of the vulva, example leukoplakia. Vulval candidiasis, microorganism Candidia albicans. Diagnosis by biopsy. Treatment 7 to 10 days topical fluconazole, and resistance cases of fluconazole orally 150 milligram weekly for 6 months. Investigation, urine analysis, stool analysis, full blood count, examination list scrubbing, and the last one is biopsy. Treatment of the cause, مشكلتنا بالdiabetic, treatment of diabetic, general management, sedative, antihistamine, estrogen therapy, local treatment like local cleaning, antipruritic, local application as calamine lotion, hydrocortisone ointment, and estrogen in menopausal patient. Then, vulval candidiasis, the most important is Candidia albicans, the cause. Diagnosis by biopsy, treatment 7 to 10 days of topical fluconazole, and in resistance cases is 1 capsule weekly for 6 months. Investigation, urine analysis, stool analysis, full blood count, and biopsy. Treatment of the cause, sedative, antihistamine مثل ما حكينا بالvulvitis, estrogen, local treatment like local cleaning, and maybe local application as calamine lotion or hydrocortisone ointment. Answer with the true or false for the following statement. Vulval candidiasis mostly caused by gonococcal infection.
False.
False. True is Candidia albicans. In resistance cases of Bartholinitis abscess, maybe need excision of this gland.
True.
In resistance cases of vulval candidiasis, treatment is fluconazole 150 milligram monthly for 1 year.
Weekly for 6 months.
Yes, weekly for 6 months. Pruritus vulvae may be associated with vaginal discharge and maybe without vaginal discharge.
True.
True. قد يكون with vaginal discharge وقد تكون هذه البرورايتس without vaginal discharge. Vulval dystrophies is a local cause for vulval candidiasis.
False.
False. Vulval itching. Vulval itching. Oxyuris infestation is one of the causes for vulval ulcer.
False.
Itching. Vulval itching. Oxyuris infestation vulval itching مو vulval ulcer راح يصير. Urine analysis for sugar and glucose tolerance test is important investigation to diagnose vulval candidiasis.
True.
Yes, very good. Anti-pruritic local applications such as calamine lotion, hydrocortisone ointment are important for treatment of vulval candidiasis. True. Anti-pruritic حتى بالبرورايتس vulvi ممكن نستخدم calamine lotion and hydrocortisone ointment. We start with ulcer of the vulva. Ulcer of the vulva. The causes of the ulcers of the vulva. Either the cause is a sexually transmitted disease. The first point is sexually transmitted disease. Or is a traumatic ulcer. Or is it tuberculous ulcer, or bilharzia ulcer, or malignant ulcer اللي هي squamous cell basal cell, or behjet ulcer. Sexually transmitted disease. The most common is syphilis, soft sore chancroid, lymphogranuloma venereal, granuloma inguinal, herpes genitalis, and human papilloma virus. We are repeating. Ulcer of the vulva, sexually transmitted disease, or traumatic ulcer, or bilharzia ulcer, or tuberculosis ulcer, or malignant ulcer, or behjet. Sexually transmitted disease include maybe syphilis, soft sore, chancroid, or lymphogranuloma venereal, granuloma inguinal, herpes genitalis, or human papilloma virus, condyloma acuminata. We start with syphilis, either primary chancre, or secondary mucus patches, or tertiary gamma. Primary chancre feature مالته painless solitary ulcer. Painless solitary ulcer. Firm, enlarged, non-tender lymph node. Painless solitary ulcer. Primary is painless solitary ulcer. Firm, enlarged, non-tender lymph node. Investigation, we are positive for laboratory research, venereal disease research lab, venereal disease research lab, and rapid plasma regan. These most important investigation to diagnose the syphilis. Secondary mucus patches or ulcerated condylomata lata. Tertiary gamma or diffuse systemic inflammation. Then هسه ulcer of the vulva, the first point is sexually transmitted disease like syphilis. Syphilis, either primary painless solitary ulcer, secondary mucus patches, or diffuse systemic inflammation. Treatment by benzathine, penicillin, doxycycline in case of allergic to penicillin. Treatment of syphilis, benzathine, penicillin. If allergic to penicillin, will be treated with doxycycline. Second point of sexually transmitted disease would be cause ulcer is soft sore or chancroid. Tender red papules filled with pus. هنا painless solitary ulcer. هنا tender red papules filled with pus. No any duration. Tender inguinal lymph nodes. هنا non-tender lymph node. لو نقارن بين البرايمري chancre of the syphilis, painless solitary ulcer. إذن حتى الليمف نود non tender، لكن هنا tender red papules filled with pus, no any duration tender inguinal lymph node caused by Haemophilus dicturi. Diagnosis by biopsy, treatment azithromycin 1 gram orally in a single dose or ceftriaxone 250 milligram iron. إذا هنا بالسوفت سور للتريتمنت راح يكون azithromycin 1 جرام single dose أو يكون ceftriaxone 250 ملغ iron. أيضا نضيف عليه أنتيسبتيك، نضيف عليه أنتيهستامينيك. إذا أتى مريضة من اتشك نقدر نستخدم لها كلاميد لوشن لأن هي tender red papules filled with pus. This is the soft sore chancroid. Third point is lymphogranuloma venereum. There is ulceration of the vulva, rectum and gryom. Lymphogranuloma venereum. Ulceration ايش راح يشمل هنا؟ vulva, rectum, gryom. Tender mass arise in the inguinal area caused by Chlamydia trachomatis, diagnosed by biopsy, treatment doxycycline or erythromycin. We are talking about the ulcers of the vulva. Sexually transmitted diseases include syphilis, soft sore, and lymphogranuloma. Syphilis, either primary painless solitary ulcer with non-tender lymph node, or mucus patches or ulcerated condylomata lata, tertiary gamma or diffuse systemic inflammation. Treatment with benzathine penicillin, doxycycline in case of penicillin allergy. Soft sore chancroid هنا يكون tender inguinal lymph node, cause Haemophilus dicturi, confirmed by biopsy, treatment azithromycin 1 gram orally in single dose or ceftriaxone. Lymphogranuloma venereum feature اللي هنا ulcer للفالفا, rectum and gryom. Tender mass arise in the inguinal area caused by Chlamydia trachomatis. Also diagnosis by biopsy, treatment doxycycline or erythromycin. Fourth point of sexually transmitted disease will be caused vulval ulcer. Granuloma inguinal, presented with a clean granulomatous, sharply defined multiple confluent ulcer. Diagnosis by Donovan bodies, treatment 3 weeks doxycycline or ciprofloxacin. إذن هسه التريتمنت اللي استخدمناها للسفلس بنزاثين بنسلين أو دوكسيسايكلين. سوفت سور كان لا azithromycin, lymphogranuloma venereum, doxycycline or erythromycin. Granuloma inguinally 3 weeks doxycycline. And the fifth point is herpes genitalis, produced itching and tingling. يصير تنمل أيضا وياها حكة. Multiple small painful blister, progress to shallow ulcer, may be associated with urinary retention. Herpes genitalis. Herpes genitalis. Recurrent rate is 50%. Crust over 7 to 10 days. Recurrent rate is 50%. Either spontaneous resolution or need a cyclovir every 6 hours for 5 days and maybe need Foley's catheter because of urinary retention. Ulcers of the vulva. The first one, sexual transmitted disease. Syphilis, painless solitary ulcer, non-tender lymph node, mucus patches or ulcerated condylomata lata, or diffuse systemic inflammation. Treated benzathine penicillin, doxycycline in allergy. Soft sore هنا راح يكون tender red papule, tender inguinal lymph node caused by Haemophilus dicturi. Diagnosis by biopsy, treatment by azithromycin 1 gram oral in a single dose or ceftriaxone. Lymphogranuloma venereum. The feature here is the ulcer will be related to vulva, rectum, and gryom. Also, the cause is a chlamydia trachomatis, treatment by doxycycline or erythromycin. Granuloma inguinally, here presented with multiple ulcer, diagnosis by Donovan bodies, treatment 3 weeks doxycycline or ciprofloxacin. Herpes genitals, itching, tingling. Blister will be progress to ulcer, may be associated with urinary retention, crust over 7 to 10 days. Recurrent rate is 50%. Treatment either spontaneous resolution, acyclovir, maybe need Foley's catheter. Condylomata acuminata, human papilloma virus. هنا راح يكون wart, flat wart, not associated with pain. It's self-limited over about 9 months. Treatment by podophyllene or cauterization. Flat wart, not associated with pain. Self-limited over 9 months. Treatment by podophyllene or cauterization. Can be used in extensive condition. As we say, vulval ulcer, either sexual transmitted disease, traumatic ulcer, tuberculosis, bilharzia, malignant, اللي هي squamous cell and basal cell carcinoma, rodent ulcer, and the Behçet ulcer. Answer with true or false for the following statement. Soft sore, chancroid, associated with vulval ulcer and inguinal, tender inguinal lymph node.
True.
True. Primary chancre is a painful solitary ulcer with painless
False.
lymph node. False.
False.
Painless. اثنينهم painless الليمف نود وأيضا هو الألسر. Treatment of chancroid by azithromycin 2 gram orally as a single dose.
False.
False. 1 gram. Vulval ulcer will be include sexually transmitted disease like syphilis or may be due to malignant ulcer such as squamous cell carcinoma or rodent ulcer.
True.
True. قد يكون malignant وقد يكون هنا sexually transmitted disease. Foley's catheter may be needed in treatment in a case of vulval ulcer due to chancroid.
False. Herpes.
وحيدة هي الهربس جينيتاليس اللي كان بها تتداخل ويا اليورينري retention. Recurrent rate of vulval ulcer due to herpes genitalis is 50%.
True.
True. 50% يصير عندهم هنا recurrent rate. Yes. Lymphogranuloma venereum. This is mean ulceration of vulva, vagina, rectum, and gerion.
True.
Lymphogranuloma venereum is ulceration of vulva, vagina, rectum, and gerion.
Without vagina.
ما عندنا الفاجينا، فقط الفالفا، rectum وجريون، 3 مناطق. Yes, very good. Treatment of herpes genitalis may be need acyclovir 200 milligram every 6 hours for 5 days or azithromycin. herpes genitalis تختلف إنه موجود عندها مشكلة باليورينري ريتنشن، ممكن نحتاج لها فوليس كاثيتر، وعندها ريكرنت ريت 50%، وأيضا عندها صفة إنه نعالجها بالأسايكلوفير. فهسه السؤال مالتنا إنه التريتمنت with acyclovir 200 milligram every 6 hours for 5 days and azithromycin.
False.
False. إحنا قلنا فقط الأسايكلوفير. فقط الأسايكلوفير. Yes. We are talking about the swelling of the vulva. Swelling of the vulva. Swelling of the vulva may be congenital, or traumatic hematoma, or inflammatory, congenital swelling, or maybe a traumatic hematoma after excision of the Bartholin cyst as a diffuse cystic tender swelling dark in color. هنا راح يصير اما بعد الليبر او بعد الاكسجين للبارثولين سيست ممكن يصير هيماتوما. اذا نحتاج هنا انسجين and ligation of the bleeding vessel of the hematoma is large or increasing in size. And the third point is inflammatory vulvitis, Bartholin's abscess, hypertrophic tuberculosis bilharzia, polyp, condylomata lata and condylomata acuminata. إذا السويلنج of the vulva أما يكون congenital أو traumatic اللي هي الهيماتوما after excision of Bartholin cyst or after labor. Treatment incision and ligation of the blood vessel if large or increasing in size, and inflammatory swelling, vulvitis, Bartholin abscess, TB, bilharzia, and other. Or the fourth point is benign neoplasm like fibroma, lipoma, papilloma, adenoma, hydroadenoma, and other tumor like leiomyoma. And the last one is urethral caruncle. Then the swelling of the vulva include the following: may be congenital or traumatic hematoma or inflammatory like vulvitis or Bartholin abscess, or benign neoplasm and malignant neoplasm. Swelling of the vulva, congenital, traumatic hematoma usually after labor or excision of the Bartholin cyst, and this is need to incision and ligation of a blood vessel. Inflammatory like Bartholin abscess, vulvitis, and other. Benign neoplasm like fibroma, lipoma, papilloma, adenoma of the Bartholin gland, hydroadenoma, and other tumor. And the last one is urethral caruncle. What is meaning of urethral caruncle? Is a small red pedunculated swelling at the posterior lip of the urethral orifice. Urethral caruncle, considered as benign neoplasm, will be cause swelling of the vulva. This is a small red pedunculated swelling at the posterior lip of the urethral orifice. Clinically, it presents with dysuria, dyspareunia, and irregular bleeding. Treatment is cautery or excision, include the base and dealing with any cause as chronic urethritis. Benign neoplasm like fibroma, lipoma, papilloma, adenoma of Bartholin gland, hydroadenoma, and other tumors like leiomyoma. And the last one is urethral caruncle. Urethral caruncle is benign neoplasm, causes swelling of the vulva, is a small red swelling at posterior lip of urethral orifice. May be cause dyspareunia, dysuria, irregular bleeding. Cautery or excision including the base and dealing with any cause as chronic urethritis. And malignant neoplasm. Malignant neoplasm will be primary carcinoma or sarcoma and secondary. Primary and secondary. Direct excision of carcinoma of the vagina or urethra, and secondary may be due to carcinoma of the vagina, direct extension, or maybe retrograde lymphatic or vascular spread. Malignant neoplasm of the vulva أما تكون primary أو تكون secondary. Secondary either direct extension of carcinoma of the vagina or urethra, or retrograde lymphatic or vascular spread. The commonest are secondaries of choriocarcinoma reaching the vulva by retrograde vascular spread. إذن كان الموضوع الأخير هو حول السويلنج of the vulva اللي يكون أما يكون congenital, traumatic hematoma اللي هي يكون after labor or excision of Bartholin cyst, أو inflammatory مثل Bartholin abscess or vulvitis. Benign neoplasm اللي هي راح تكون fibroma, lipoma, papilloma, adenoma, and other. Urethral caruncle is a small red pedunculated swelling at posterior lip of urethral orifice, dysuria, dyspareunia, irregular bleeding, cautery or excision including the base and dealing with any cause of the chronic urethritis. Malignant neoplasm either primary or secondary. Secondary either direct extension of the vagina or urethra or retrograde lymphatic or vascular separate. إذن هسه كانت محاضرتنا حول Benign Vulval Disease. Benign Vulval Disease. تحدثنا بالبداية عن الديفينيشن للفالفا والفستيبولا والفيتشرز اوف ذا سكن. بعدها الفالفايتس تقسيماتها كان برايمري وسكندري. برايمري سكشوال سكن ديزيز كرونيك سبيسيفيك انفكشن. سكندري للاذر اورجان اللي هي يورينري فيجينا ريكتال اور iatrogenic. Symptom and sign and investigation and treatment of vulvitis. Type of vulvitis diabetic vulvitis Bartholinitis أيضا تحدثنا عنها. بعدها Pruritus vulva اللي هي vulval itching causes general and local causes. vulval candidiasis اللي هي candida البيكانس وأكثر شيء تحتاج إلى glucose tolerance test. full blood count stool analysis and biopsy. Treatment of the cause and sedative antihistamine local application. Ulcer of the vulva either sexually transmitted disease or secondary traumatic tuberculosis, bilharziasis, malignant or behjet ulcer. Swelling of the vulva may be congenital, traumatic, inflammatory, benign neoplasm and malignant neoplasm. Benign neoplasm واحد من عندهم اللي عندنا urethral caruncle اللي هو small red pedunculated swelling posterior lip of urethra, dysuria, dysphoria, excision. This is the best treatment. And vulval hematoma may be occur after labor or after extension of Bartholin cyst, and incision and ligation of the bleeding vessel of the hematoma is large. And the third one is Bartholinitis. Thank you very much. عندنا سؤال.